Hello, doctors. Excited to be here tonight. This is Doug Grant, and very uh, just emotionally charged about our topic tonight. It's going to be great to discuss some of the research and some of the things that are out there that we're actually being able to finally expose in the industry that is holistic health professionals we've known, but it's nice to be able to get validation of. And I'm excited for you to be on to hear some of these new things and the new research that's out. I wanted to start off tonight to just mention the event that we'll be at coming up February 23rd through 25th here in Tempe, Arizona. And that's the Brimhall Homecoming Seminar with Dr. John, a good friend and partner with the formulas he comes out with, and excited to be able to be there. We'll actually, as a formulator from Optimal Health Systems, and our team be on stage a good 10 hours over those days, teaching you the latest research on what's happening in the industry, condition protocols, how to treat certain things nutritionally with the supplements, finding out a lot of what's going on in the trends of the industry so you know how to approach your patients and the things to say and the things to do. So that's just our side of it. But having Dr. Harris, Dr. Brimhall, and so many other great speakers there is going to be great. And I just want to encourage you, if you haven't yet, sign up. Call in here to the office or to the Brimhall office and get signed up for it. We'd love to see you in person and really have you be involved in some of this cutting edge material that we're going to be sharing. As mentioned, Dr. Brimhall is going to, it's a homecoming for him. Basically been doing it for decades, and we're excited to have a line of products that he has formulated that we've just helped with the absorption and assimilation through the pre-digestion, and it's great to have him on board to be able to help with those specialty formulas, especially for those types of needs in the body, and uses different things, the glandulars and that we've never had before, but with his special line. And you can always designate his line with the purple label from the Optimal Health Systems regular line, so you'll be able to know when you're getting a Brimhall formula, which is really great and we have available. For those of you that are new, I wanted to really point out before we got into tonight's topic about the difference between the different types of formulas that are out there today versus chemical drugs, prescriptions, synthetic vitamins and that. And really the big difference with us is we understand the importance of delivering whole food nutrition to the cellular level so the body can heal itself. But we know through research, through statistics, that the body does need a lot of different nutritional variants and components at different times based on the condition that the body's going through, the state of dis-ease, if you would. And so because of that, basic formulas that are synthetic or low dose vitamin formulas really don't do the job when we really need to give therapeutic amounts, especially as holistic healthcare professionals. And so we developed a way to be able to ferment the vitamins and to pre-digest them to deliver them in high potencies to the cell level. And that's really what sets apart the way we look at nutrition and nutritional formulations versus all the other companies on the market today. Now, the problems most therapeutic supplements used by health professionals, as Dr. Royal Lee, one of the great founders of the movement of holistic nutrition, found out, was that we need to deliver only whole foods and not synthetics. And the synthetics are what cause the problem. And that's why we focus strictly on those factors. And so tonight I'm going to be your host. And I just want to give you a little background. My background's in nutrition with a post-grad in American College of Sports Medicine and as a trainer nutritionist. But as you know, I've been working with thousands of doctors for over 20 years now, helping to find ways to help our patients improve their health through proper diet, through therapeutic nutritional supplements, using only whole food and obeying the laws of nature, but using research and statistics to help us know what we should give and how we should give it to the patient. So tonight, our webinar is on muscle pain and how to fix it, what are the causes of it, how to differentiate it, and also on big pharma cover-up that's really exposed now. And actually, we're going to start off with that tonight, is straight into it, of the exposing of the big lie that's been going on for years now. Now, pharma has created this myth, and I think all of us have heard it a zillion times, that taking NSAIDs or aspirin daily helps with heart disease risk. I mean, think about it. How many times have you heard that? Well, I take my aspirin or my baby aspirin and that to help with lowering my risk of heart disease. Well, that is such a huge myth and a huge lie. And it was really great to see that we know, well, just back up a little bit. We know that non-steroidal anti-inflammatory drugs, or NSAIDs, are actually the most frequently used group of pharmaceutical compounds there is. So above everything else, they're the most used compounds today. Now, we take the fact that this is the most used drug there is in the world and prescribed, and then what do we have from that? We know that the research shows that the FDA has now come out and proven that NSAIDs and aspirin is actually extremely damaging the body and actually causes heart disease. The FDA updated its warnings for prescription and over-the-counter non-steroidal anti-inflammatory drugs to say they increase the chance of heart attack and stroke. Now understand that, they increase the chance. The drugs like ibuprofen, Advil, naproxen, Aleve already carry warnings that may cause increased risk of heart attack and stroke. But get that, they already have that on the labels, and they're now having to change it even further. People are taking these things without even reading the labels. They're taking it thinking it's helping with heart disease, when on them it says can cause an increased risk of heart failure. And then the FDA's come out now and even taken it a step further. And they've said what? There's no period of use shown to be without risk. Think about that. So we're not talking about taking a little bit and it being okay or small dosages. There is no period of use shown to be without risk if you take NSAIDs, the ibuprofens, and these factors. Look to the bottom. Ibuprofen more than doubled the risk of major coronary events. All NSAID studies were linked to a 2 to 4-fold increased risk of gastrointestinal complications. That is absolutely amazing. We know that the main factor is pain. That pain accounts for more problems than all of the diseases combined. Even though the diseases might have pain, pain is the main thing that people go in to a doctor about to try to help get fixed. It's the major problem doctors your patients come in with, right? Some form of pain. Isn't that the main reason they come to see you? Well, NSAIDs, we know, cause disease now. So what do you do as a health professional when you know your patient is going to take something for the pain? You know they're going to do it. So what in the world are we giving them? Now, a lot of people will say, well, I don't recommend, drugs or that. Well, if you don't recommend something to an alternative, then you're recommending the drugs, because we know that they're going to go out and they're going to take them. We know that. So we've got to come up with a way to help them know that NSAIDs are actually causing more problems than they fix. So what type of muscle pain are we talking about, and how do we identify it? We know muscle pain can be from impact injury. We know that muscle pain can come from imbalances from an agonist and antagonist muscle, the hamstring to the quad or bicep to tricep, whatever it might be, causing pain or pull on the muscle. We know that there's pain from micro tears from sports, training, exercise, working out. We know there's pain from nerve from subluxations or dislocations, degeneration of the joints, allowing the nerve to be impinged on. We also know there's muscle pain from autoimmune disease. So today, the most common treatment for pain to be taken orally, recommended by doctors, including chiropractors, NSAIDs. And again, how many of you right now say, nope, I don't recommend NSAIDs? Again, if you don't recommend an alternative, doctors, we're basically recommending them because they're the most widely used drug there is. So if people are taking them, we've got to help them to get off of it. So what's some of the other problems of NSAIDs that we really need to expose today? 1 kilogram of aspirin causes kidney disease. Well, I don't take a kilogram of aspirin. Do any of you? 2.2 pounds? No. But in the research, it can be accumulated. In other words, over time, 3,000 aspirins equal 1 kilogram. That's how many people take an aspirin or a few aspirin a day. Well, then it's just a few years down the road that they still are going to have those problems, kidney problems, liver problems, because of the accumulative effect. We know we need to get these out of the thought pattern of the public, maybe use them in times of serious need, but not on a daily basis at all. So the process of inflammation, to take everyone back a little bit to college days, pain, swelling, redness, and sensation of heat at the injury site is a sign, obviously. Inflammatory response involves cells of the reticuloendothelial system. We know that. Following trauma, the vascular wall changes, producing an escape of plasma and fluid from that space, creating the symptoms that we just talked about. We know that that's how it works. We know for a fact it does. And there's specific chemical inflammatory mediators that are produced at the injury site. We know of those as histamine and prostaglandins. Also, white blood cells come there to start cleaning things up. And here's a picture of a muscle that has been damaged, and we see the damage here in the white, and the cells are starting to come in to see what we can do about it. They start coming in, cleaning up the damaged area, start to see the white go away there. Cells are coming in to fix it up. And then over time, eventually things clear up and we're muscles back to normal tissue. This is about a 21-day process in this picture. And so we know the process, we see the process, we know what happens in the body until we finally get back to healthy muscle tissue again. Now, the speed at which inflammation occurs and is resolved is regulated by what we know as prostaglandins. There's good prostaglandins and bad ones, and this is probably helping us all remember back to the days of hearing this. But the reason I'm going over this 101 again on inflammation is because we've got to understand prostaglandins in order to understand what we can do to replace NSAIDs. NSAIDs block both types of prostaglandins, the good and the bad. So they reduce swelling, but they slow down the healing process by blocking the prostaglandins that help in the healing process, that help send in the good guys to be able to pull out the damaged tissue and to repair and to heal. NSAIDs block both. We know this for a fact. We've seen the research. This was a study done at the University of Toronto that we monitored closely because they used our formula when they did it. And we couldn't be a part of it, but we were able to watch as things went on. And they were able to show that, yes, without NSAIDs, we have a tremendous amount of swelling. With NSAIDs, then it comes down. But also on the proteolytic enzymes, the middle one here, we're able to reduce swelling at the same rate as NSAIDs with proteolytic enzymes. But more importantly, the healing time. We're able to heal the middle graph faster than the group that took NSAIDs. The NSAID group was on the right, that big long yellow one there on the right side. It actually took longer to heal by taking NSAIDs than the group to the far left that didn't take any. So in other words, you heal faster by not even taking aspirin and that from an injury than if you did. So basically, we know that NSAIDs block prostaglandins, both of them. We can see it in the research. We know what happens. The neat thing is proteolytic enzymes in the right amounts and the right type not only reduce inflammation at the same rate, but they increase healing 3 times faster. That's an amazing and important concept for getting your patients back to work in time, getting athletes back on the court and on the field. There's a lot of great research on proteolytic enzymes, double-blind studies of 146 boxers showing that most of them didn't even get bruised, the ones that took the enzymes before the event versus ones that didn't. Soccer players being able to reduce the amount of inflammation to begin with and also be able to get it to come down faster by taking proteolytic enzymes. We know it inhibits aggregation. And the proteolytic enzymes in the treatment of athletic injuries is in the Fisher-Trethart study that I just mentioned to you guys. So we know that the research is strong, that we can absolutely positively help reduce pain and inflammation through the use of proteolytic enzymes. And we also know that the big pharma is being exposed finally at the level that's needed, showing that aspirin and these NSAIDs actually cause heart disease and cause more damage and cause the body to take longer to truly heal. And we've got to be the ones to sound the alarm to our patients. We've got to be the ones to stand up to tell the truth about it. Well, what about fibromyalgia? What about these other muscle conditions? What can we do about them? And is it different than what we do for people with just traumatic pain from trauma or things like that we just went over in the body that happens with the muscle? So to understand that, we'll do a quick understanding of autoimmune disorders again real quick, and we won't spend a lot of time on it. But I want everyone to remember that until 10 years ago, we didn't really have detailed statistics on how bad the epidemic of autoimmune disorders really were and how many people were affected. We know that there's over 100 autoimmune diseases that are out there and growing, and the body's attacking itself. And that's what it is. It's an illness that occurs when the body tissues are attacked by its own immune system. And the immune system, we know, is a complex organization within the body that's designed to seek and destroy these invaders. And now the body's going after itself. So it's a problem mentally too, because people know something's wrong and they're told there's not anything wrong. 50% of all cases involve women. They're told nothing wrong for 5 years before they finally identified conclusively that it was an autoimmune disease. They're increasing so rapidly that now statistics show that we're more likely to suffer from an autoimmune disease than heart disease or cancer, and that autoimmune diseases can average of 15 years off of people's lives, and dramatically, as we know, lowers the quality of life. So with these things, we need to take notice. But tonight, instead of focusing on all of them, I just really wanted to focus in on fibromyalgia. And the reason I wanted to do that with this talk on protein and on inflammation and muscles is because most of these autoimmune diseases are caused from proteins. Proteins can be viruses, they can be bacteria, they can be food proteins, they can be environmental toxin proteins, but from proteins. And if our body can break those proteins down, those viruses, those foods, and those things, then the body can eliminate them without causing a problem. But we know, and this is a study I wanted to bring up that's probably new to most people, is that there's a reduced functionality of proteins in the intestinal tract, gastrointestinal tract, as a possible cause of fibromyalgia. We know that non-digestion of proteins and proteins getting into the system that shouldn't is one of the major causes of fibromyalgia. So we're talking about pain in the muscle. The doctors, you're working with a patient and you can't identify it. There's not a subluxation to the nerve that leads to that muscle. There's not an injury to that muscle, but the patient has muscle pain. Muscle pain. We know now through the research that many times it's due to poor protein digestion. And those proteins getting in that mimic some of the proteins in the muscle and get into the muscle, but they're not the exact amino acid chain complex that the muscle can use, and it's causing almost like little crystal, uric acid type crystal-like formations. It's causing tremendous amounts of pain. Patients with fibromyalgia show the hypofunctionality of the protein system. And that hypofunctionality is the first biochemical alteration observed in fibromyalgia that we know consistently is observed. So doctors, protein. If we break protein down by using the enzyme protease, it's broken down to something called peptides. Those peptides are then broken down by another enzyme called peptidase. So protease and peptidase breaks the proteins down to usable amino acids that cannot be taken in and created into fibromyalgia, that cannot then cause other damage in the body, but they can be built back up to actually help fix the problem. So we're not talking about just eliminating the cause, we're also at the same time helping to fix the problem, to be able to help with the cure. So we know that we deplete our protease enzymes, our protein digestion enzymes over time. And the body's meant to take in amino acids, 1, 2, or 3. In other words, one or bound to another, a dipeptide or a tripeptide. That's it. But anytime the body takes in amino acids that are more than bound to 3, then, and it's not supposed to, it's due to a leaky gut, these get into the system, and that's one of the causes of fibromyalgia, other types of autoimmune diseases, and a lot of muscle pain. So remember, the white blood cells normally protect the body from antigens. But in this case, when they're attacking the body because they got into the system, there's a huge problem. Like in the case of caseinate, its structure is such that because it gets down and not into a single amino acid, if it gets in the system due to leaky gut, and a lot of times it does, we know the research shows that sometimes up to 7 amino acids are getting into the system because enzymes didn't digest the protein properly, in this case casein, or we have a major leaky gut and the body doesn't have a chance. The same structure casein has at the 7 amino acid level is the same as the islets in the body that create, as we know, insulin. And so what's happened, the body starts attacking itself. Boom, type 1 diabetes. So we know that these things happen because of the non-digestion of proteins. And whatever type of protein it is that's not being broken down determines the diseases. That's the problem. So we need to break down these proteins, whether we already have inflammation from other reasons, or we're trying to get the body to quit attacking itself. Again, we can't do anything to boost the immune system per se, because we have an autoimmune disease going on. We need to get in and get after the attackers. So there's different formulas that we use. We use a digestion formula to say, patients, if you do nothing else, take an enzyme with everything you eat to ensure it gets broken down so we don't have these things floating around the system. And we use the flora to tighten up the zonulins, the juncture in the intestine, and the fruit and veggie to help with the free radical damage. We know these things are important. There's different things like Dr. Brimhall's created to help with the detox, with the metals and that is very important for a lot of you that use the homeopathics. The main thing I wanted to focus on tonight was the research on acute, because in my opinion, and the opinion based on everything I've shown you from the research tonight, think about it. If we can digest protein, get people to eat healthier proteins, if we can break those proteins down, then we're going to eliminate most of the problems and we're going to help reduce inflammation, speed up healing, and get these excess multi-strain amino acids out of the system so that we can help the body heal itself. And the best formula to do that's acute. It's a super high potency proteolytic, protease peptidase enzyme formula with ginger and that to help with the stomach that gets in and is able to break them down. And the research that we shared with you tonight is from this formula. The Treithart study out of the University of Toronto was on our formula. So we know that its effects. It's not this another Me Too type thing where you try to duplicate someone else's work. For a lot of you that deal with joint pain, we made life easy. You combine the acute and chronic, and it was called the joint pack. The professional athletes use this a lot. I recommend it a lot because it's easy for people to put packets in their pocket. The nutrients, the glucosamines, and the chondroitins for the joints, and the protease enzymes for the inflammation and the healing process. So let me recap, doctors. Big Pharma is exposed with research and the FDA agreement that NSAIDs cause heart disease, and it doesn't help it. We know this for a fact. The research is strong enough that even the FDA's come out and said it, which is really interesting. And it says it on the labels. If a patient doesn't believe you, tell them to read the label of their NSAID, of their ibuprofen, of their Aleve, of all these things. It causes heart disease. Look at the research that we presented tonight from the Treithart study. It actually takes longer to truly heal when you take NSAID versus not taking anything at all. But we know we want to be out of pain. You want your patients out of pain. They will take something. Your patients will take NSAIDs unless you give them an alternative. Acute, optimal acute is the alternative. Because of the research, you can show them that it's not just something you're saying here, try this. No, we know what it does. We know exactly the anti-inflammatory capabilities and the healing properties. Muscles, whether they're damaged from accident, sport, wear and tear, nerves, subluxations, dislocations, or proteins from foods not being digested, all need proteolytic enzymes to heal or to be completely broken down. Fibromyalgia is just one great example of an autoimmune disease that needs proteins digested in order to get pain out of the muscles. If you want to help someone get pain out of their muscles, load them up with the acute formula and watch what happens. It's one of the best things that you'll ever see. especially when it comes to even things not just like fibromyalgia, but gout, those types of things. One of my best friends came because he was actually anti nutrition and me at first until he had gout and they gave him the acute and it went away. And now all of a sudden we've been friends for 30 years. So it's one of those things that happen. And docs, if you don't have a system to stay connected with your patients are going to belong to the office that does. And so we want you to take a look at the EduMails that we send out, the Thrive system that you can use for your patients. Call us and we'll turn you on to the people for that. If you're not staying connected with your patients, with your office, blaring out to them what you have to offer, to continually teach them these facts about NSAIDs and all of these things they need to be aware of, they're going to go somewhere else. They're going to get led astray by all the marketing and the Facebooks, Instagrams, Twitters out there today, trying to get them to go the way of the world and toward big pharma, when we know the research and common sense tells us to go a different way. But we have to stay in their face. We have to be there and be present and with a voice. And so we help provide that through the Thrive system. I write emails and do videos every single week, articles to go out to you and to your patients every week to stay up on the latest advances of nutrition, to keep them foremost in their mind. And if you haven't yet, download a little thing called Instagram and just decide who you follow. Follow a couple other health professionals. Follow OHS for Life on Instagram, and we'll keep you updated with quick little things a couple times a week on the latest advances in nutrition and just some fun stuff. Social media can be bad or good. It all depends on you. The good thing about social media is you choose who you follow. Just follow healthy things. Follow other practitioners and people that are teaching health, and have your patients do that also. So doctors, really wanted to thank you for coming on tonight. I wanted to try to keep it as short as possible, give you just a tremendous amount of information. Clark from Thrive is going to have this put together so that you can download it and watch it and show your staff members. I highly recommend that, and the other health professionals that you come across, and sometimes even your patients, if you feel it's worthwhile. Highly recommend. Say, patient, look, take 30 minutes. We won't even 30 minutes tonight, and just watch this, become educated, become aware of what's going on today so you can make the right choices. And many times that other voice, teaching your patients, teaching your staff, can be the thing that helps them take it to the next level so that they improve their health and the health of others. The doctors really appreciate your time tonight. Look forward to hopefully seeing you at the Brimhall Homecoming later on in a few weeks here in Tempe, Arizona. It'd be nice and warm, and look forward to seeing you. If not, we're planning on traveling this year to different places around the nation and look to hook up with you to share with you the research and things that you can do to take your practice health to the next level as you take your patient's health to the next level. Have a great night, and we'll talk soon.